Well, I'm joined now by Professor Justin Stebbings, who's a consultant oncologist at Imperial College, and by Ros Jones. Her son Alex had surgery for brain cancer in 2008. The family had to raise £100,000 to pay for proton therapy treatment in Florida. Welcome to you both. Ros, first of all, this seems a broadly similar case, but what I'm interested in, did you hit a similar sort of brick wall with the NHS and the hospital concerned, which left you with no choice but to make that extraordinary journey and financial sacrifice?
Absolutely, that's exactly what happened to us. We were told when we went to see the oncologist that if he had radiotherapy he would be blind, deaf, possibly in a wheelchair if he made it, because his prognosis was terrible. So then I said, well, what about the proton therapy I've been reading about? Oh, no, that's not tried and tested, and they're only after your money. You mustn't, take him to the States. And I'd already spoken to the Americans, and they explained to me how it works, and they were very impressive. So, no, it was a very difficult decision to go against our doctors here, our doctors that I know and I trust.
But briefly, the right decision?
Oh,
in
yes.
terms of Alex?
Oh, yes, because my little boy is perfect. He's got no side effects whatsoever. He's perfect, a happy little boy.
Right. Justin Stebbings, nobody would pretend doctors are infallible, least of all right. You, I suspect. But there is a cautionary tale there in what Ros has just said.
Yeah, absolutely. I agree with Ros. And when you see Alex sitting outside, he's a gorgeous boy, developmentally normal. But, these days in oncology, treatment's very multidisciplinary. And by that, what I mean is all the different treatments we have, such as surgery, chemotherapy, targeted therapy, and radiotherapy, are part of a jigsaw. And proton therapy is a subset of radiotherapy. There's many types of radiotherapy, but proton therapy clearly has some advantages. So protons, if people remember sort of from their chemistry days, make up part of the middle of atoms, the nucleus, which is very heavy. So when they're given as part of treatment, they don't scatter, so it can be very, very targeted. Now, what we try and do as oncologists or doctors or healthcare professionals is we try and individualize treatment. So we want the right treatment for the right person with the right tumour at the right time, right, to maximise the effectiveness and minimise the toxicity, and that's clearly worked in Alex's case.
Right, so we're all individuals, it's
right,
individual.
Absolutely.
But to put a rather blunt question, yeah, are there people out there where medicines meet markets who bluntly are promising things that are not perhaps appropriate because they make money?
Well, I think the internet, for example, is a dangerous thing. It's a double-edged sword, for example, that people are always entitled to seek care where they want. And as doctors, we're clearly not infallible. We can only try our best and give our best advice. But when it comes to various aspects of treatment, such as proton therapy, it's clearly effective in certain indications, such as tumours of the back of the eye, some rare tumours. I mean, the incidence of childhood tumours is 5 per 100,000 of the population, right, so these are rare. Some other rare cases, but can we use it in common tumours, so breast, lung, colon, prostate cancer? The data are not yet there, and we need those data. So if we had machines in this country like they have in America, one advantage of that is at least we could study it to answer those questions, right, because we're putting more and more patients into clinical trials now.
OK, I want to move away, Ros Jones, from medicine to interpersonal politics and management and patients. This is about a breakdown in communications, isn't it, as much as medicine?
Absolutely. What happened with this family, they should never have taken flight like that. They should have, the oncologist should have worked with them and, explained what the situation was. I don't know if he could be a proton therapy candidate. I hope so. I hope it's not too late for him to do that. But 450 children a year in the UK get brain tumours, and the Americans are treating all of those brain tumours with proton therapy now because it's the 21st century, it's a new technology, and we should have it in this country. And the only reason that we don't have it is money. It comes down to money.
Does it come down to money, Justin Stebbings?
I think the harsh reality is that institutes such as NICE are set up to institute cost-effectiveness, but interestingly, in America, they're now copying.
That's a yes, isn't it?
The answer is yes, but interestingly...
Right. OK, no, that's fine. We've got a yes on that. But I want to move on, because I think it's critical to this particular case. Ros was agreeing with me that it's a breakdown in communication. If you had a situation where, and we don't know if it's true, but certainly the husband in this case, the father, says, I was terrified of even talking to the oncologist because if I did, they would shut me down, they would put an order which meant I wouldn't be able to see my son in his hour of need. That's a situation which has gone very, very wrong, and it's nothing to do with medicine.
a lot of medicine's about common sense communication. It's not about knowing more or having the fanciest equipment. As Rod said, it's obviously a bad breakdown in communication. Southampton Hospital put out a note saying they offered a second opinion, which is always good. It's what I would do in that situation as well. I think it's what any responsible doctor would do. It is, it would create a lot of alarm for parents to take flight with the child, obviously, and it creates this sort of media frenzy, obviously, but we also don't know the individual details of the case, and I think the doctors here are bound by duty of confidentiality, so they can't
stray away from that.
They can't say anything, really.
Sure. Well, we better leave it there, but Justin Stebbings, thanks very much. Ross Jones, thank you, and glad to hear Alex is doing so well.
Thank you.